Auzu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Assalamu alaikum. My name is Dr. Ahmed Raza Khan, and today I'll be starting a series of lectures which will be compiled on the answers to the past university questions. All those questions that have been asked in the past papers for the past 10 years will be addressed in this series of lectures. And so far, the students have the compilation of only the university questions. Now, to date, as to my knowledge, there is not a proper compilation of any proper certified authentic answers to those university questions. And it is an attempt from my side to provide the students with good answers, with perfect answers, with the answers that are actually with the keys. That is the key that is provided to the examiner who checks the paper in the university. I'll be providing those key points to the students so that they can get maximum benefit out of their questions, that the answers that they are providing to those questions. So you can't be stressful anymore. You don't need to take any exam stress anymore. And even if you are preparing for your exam on the last day just before your class test, not the professional exam, definitely, you'll still be able to prepare your class test. Starting with it, I'll be providing 100% solved papers to you, and here's a series of all the lectures that I have prepared under the topic of autopsy. That is the definition and types of autopsy, autopsy protocol, autopsy prerequisites, autopsy objectives, autopsy techniques, autopsy incisions and cavity exploration, specimens for toxicological as well as histopathological examination, exhumation, its limitations and sample collection, negative autopsy, autopsy artifacts, autopsy hazards, and how to write a postmortem report. So I'll be providing you answers of each and every short essay question in individual presentations, and my each slide will be compiled on one answer, so that if a student wants to take a screenshot and memorize it in an eidetic memory maneuver, he can do so. It would be very helpful for you. I have put the answers on one slide in multiple colors so that it's eye-catching and easy to memorize. Starting with the autopsy SCQ number 1, definition and types of autopsy. The definition of autopsy: autopsy means autos, that is self, and opus means view, that is to see for oneself. And necropsy is the necros, that means dead, and opus view, so view of the dead. Basically, the term most important and significant and prevalent is necropsy. However, it is simultaneously used synonymously as autopsy also, and it is not incorrect. So autopsy or necropsy means the accurate description of the investigative dissection of a dead body. So it could be into looking into the cause of the dead body, cause of death of the individual, manner of death of the individual, mode of death of the individual. It could be academic, it could be medical legal, it could be medical autopsy. So it could be more than one types of autopsy, and we'll be discussing the types of autopsy in the coming slide. Next is the word postmortem examination. Now this word, it lacks the precision about the extent of examination, and as far as the literal translation is concerned, it means post means after and mortem means death, that an examination after death. But this is mostly used in those conditions in which there is just external examination of the body. The police requests from you that you should be able to give a few of the apparent causes of death, like in case the person has died due to starvation, the person might have died due to overdose of a drug, that person was an unknown drug addict individual, the person was a beggar, the person maybe have died due to lack of availability of the drug. So all these kind of apparent causes of death are demanded from the doctor, and the body cavities are not opened up in external examination. It is also known as mini autopsy. So if the body is to be handed over to, like for example, anatomy department for dissection, then the cavities are not to be opened up and the external examination is conducted and an apparent cause of death is declared by the forensic pathologist. Now, then there's a very important question that is asked from the undergrad as well as the postgrad students that elaborate on the statement that autopsy or necropsy is a dialogue between the dead body and the forensic specialist. Now, this is very important. Agatha Christie, in her novel, The Criminals of her novel, they say that the dead men tell no tales. And the Hercule Poirot, her detective, a very famous Belgian detective, he negates this statement and he is insistent upon that every contact leaves a trace. That is the Lockhart's principle. That whenever two bodies come in contact, they leave a trace. So, a trace evidence, a toxicological evidence, there is always some cause of death there that is present. So, body, although it is a dead body, it can't speak, but the injuries speak louder than the voice. The injuries tell you. The injuries, for example, if it's a firearm injury, it tells you which injury is the entry wound, which injury is the exit wound, and what was the damage that was done by that bullet. If it's a blunt trauma injury, if it's a road traffic accident injury, everything speaks for itself. The things, they speak for themselves. That what was the damage and how it was done and what was the cause of death. Whether the cause of death was damage to brain, damage to heart, whether the mode of death was coma, whether it was asphyxia, whether it was syncope, whether the manner of death was suicidal, homicidal or accidental, every detail the dead body tells you. Like for example, if a body is just tied up in a sack, and when you open up the sack and inside the body the throat has been slit, the teeth have been broken, and in this case you can very vividly give the opinion that the manner of disposal of the body indicates is that the manner of the death was homicidal in nature. So basically your necropsy and your autopsy examination is a dialogue between the dead body and yourself. You need to know the subject, and again, time and again I stress upon these things, that you need to be knowledgeable about every aspect of forensic medicine and toxicology, cause the eye doesn't see what the mind doesn't know. So you ought to know the subject inside out to look for what the body is telling you. Now coming to the types of autopsy. Number one, medical autopsy. Medical autopsy is by and large done for the purposes of study, for the purposes of either confirming the diagnosis or making some other assumptions that patient was not diagnosed properly, or what was the progress, whether the treatment given was adequate, or there were some any other maneuvers that could have been done to help that patient to save his life. So medical autopsy is done for these academic purposes and for the study purposes, and this type of autopsy is not prevalent in Pakistan. Next comes the medico-legal autopsy. This is by and large the most important aspect that is covered by the subject of forensic medicine and toxicology. It covers both the medical as well as the legal aspect, and in this case you have to differentiate between either the cause of death was natural or unnatural, and then in unnatural cases, what was the manner of death, whether it was accidental, homicidal or suicidal, what was the cause of death, what was the mode of death. All these things come under the category of medico-legal autopsy. The objectives will be discussed later in a further presentation. Then academic autopsy. All the students of MBBS conduct this academic autopsy. That is the dissection that they do in their first year and second year in the dissection hall. Opening up the body for the study purposes about the regions that are allotted to you, head and neck, upper limb, lower limb, abdomen, thorax, all these dissective maneuvers come under the heading of academic autopsy. Next is the virtual autopsy. In virtual autopsy, you do not open up or you do not dissect the body. You just take the computer tomography scans or the magnetic resonance imaging scans of the body and you assess the damage and the cause of death is given then. It's a good procedure as far as the cosmetic look preservation is concerned. That the body's cosmetic look is not disturbed, the body is not dissected open. Some people, some attendants, they don't want disfigurement of the body, they don't want that the body should be cut up and all that. Some people have the assumption that people remove viscera for their other malefied intentions. So in that case, virtual autopsy is considered to be the best option. But the shortcomings of this autopsy are that if you want specimens for toxicological or histopathological examination, they are not attainable. And then it's a very expensive procedure. Special radiologists are required for that, for conduction of the virtual autopsy as well as for the reporting of the virtual autopsy. So it becomes a very expensive and tough, tedious procedure. Next is the psychological autopsy. Sometimes you need to have a psychological profile of the victim that is lying on your autopsy table. Now, there was one autopsy that I conducted. That person had multiple self-inflicted injuries on both of his upper limbs, right and left side. His forearms and arms were full of hesitant, multiple self-inflicted cuts, fresh, healing, healed in all stages, scar formations. And the day he was presented to me, he had a very deep cut over both of his radial arteries. That was the apparent cause of death. So in that case, you need to ask the police to ask the relatives about the psychological state of that individual, whether that individual was under treatment of some psychiatrist. In this case that I am telling you, that person was an addict, and whenever he was short of money or short of drugs, he used to cut himself to blackmail his relatives to attain money for drugs and other purposes. And he was also under treatment of a psychiatrist, and one fine day, just due to the lack of the drugs, he cut himself. He was unaware of that. He was cutting himself so deep. It was just another cut for him, but that cost him his life. So that is the psychological autopsy. Mini autopsy has already been discussed. That is the postmortem examination that is conducted externally. Just apparent cause of death is declared in this case. Then negative autopsy, a very important term. A whole presentation will be dedicated to this heading. However, just a short introduction to it, that despite your extensive efforts, despite of your hectic dissection, despite of your histopathological examination, despite of your toxicological examination, despite of every effort that can be made under the sky, you still are unable to deduce a cause of death, then it is declared as negative autopsy. In comparison to obscure autopsy, there's a difference. There's a very fine difference between these two terms, between negative autopsy and obscure autopsy. Obscure autopsy means that there is some concealed trauma that the forensic pathologist has been unable to deduce. He has been unable to see. Again, I would stress upon that the eye doesn't see what the mind doesn't know. So you need to have a complete knowledge to avoid the obscure autopsy. And finally, the genetic autopsy. Genetic autopsy is a very budding field in Pakistan, but it needs its due attention. Now, it's not that every other body where you can't find a cause of death, you're just going to declare it as a vasovagal shock or an anaphylactic shock and just say that, or you can just say that the cause of death could not be ascertained. Genetic autopsy is a very real thing. Like, for example, in a long QT interval, that is a physiological phenomena, but still it can lead to death in certain conditions. So a genetic autopsy is very much to be considered to ascertain the cause of death in case you are unable to find the one cause in any sort of an unnatural death. Now coming up is with a presentation of autopsy protocol. Just stay tuned, and I'll be giving you all the presentations individually, which will be giving you the chance to just take a screenshot of the one slide and memorize it for a written examination, and the in-between line explanations I've been giving you are for the Viva and the OSPI. So until then, take care. Allah Hafiz.